Hi, it's Becky. Tom and Becky, B104.7. This time it's just Becky Palmer, because I'm talking about my experience with breast cancer. It is Breast Cancer Awareness Month, and I made a commitment to God, believe it or not, that this is what I would do if He would spare me my life. So this is what I'm doing. And first and foremost, ladies and gentlemen too, you think you've got something going on, or if you don't and you're to the guidelines where you should be getting a mammogram, which you said varies at different ages. This is my guest, Katie Tindall, the breast health nurse navigator at Hematology Oncology Associates. But if you think you need it, what is the age that we should start?
I think 40 or 50, depending on your family history.
My grandmother had breast cancer and my aunt, so I should have maybe started earlier.
Yeah, I mean, I think the rule of thumb is 10 years earlier than your earliest diagnosed relative. So if they were diagnosed at 55, 45. But, it's really a conversation you need to have to talk with your doctor about if it's right for you to start at 40.
I think my grandmother was diagnosed in her 80s.
Yeah. So definitely start sooner than 70.
There's been a lot of improvements in treating breast cancer. And one of the things that shocked me is I needed to go to counseling. I really did, to get through this.
Yeah,
I was
absolutely.
traumatized. I'm a breast cancer survivor, by the way, of almost 5 years. But when I was talking to the counselor, she said to me, and she used your place, Hematology Oncology Associates, that 10,000 people a year go through there that have cancer.
Yeah.
Which is a staggering number.
It's a lot.
1,000 of them die, which sounds like a lot. But when you look at the odds, that's 10 to 1 now.
Right.
And it used to be everybody in that 10,000 would have died from cancer.
Yeah.
So is it just breast cancer that's seeing all the changes, or is it all kinds of cancer? Or are they all the same?
No, all kinds of cancers, and they're all different. Traditionally we just called cancer breast cancer or lung cancer. And what we're really finding is we're drilling down and getting the genomics of the tumor. They're not all the same, and they aren't all treated the same. So we're really making individualized, specialized care per patient and their own tumor.
So it might not be chemo for breast cancer or chemo for kidney cancer.
Right.
It might be some treatment entirely different. All right. But our focus right now is, because it's Breast Cancer Awareness Month, is to promote getting a mammogram. And that's why I'm here, because as I sit here, I'm alive. My hair's not the same. I went through chemotherapy and my hair never came back. Is that normal?
It can. Chemo does a lot. It's a lot of changes, and what it really targets are those rapidly dividing cells. So your hair grows, your intestines, those cells are always changing. So you can have a lot of effects and long-term effects from chemotherapy.
Which is all right. It's all right. I got through it. And you just got to stay cancer strong, I guess is the word. My girlfriend used to call me Chemo-Sabi when she saw me in the lobby over here. Now you're trying to raise some money.
We are.
Is this for cancer research?
No, this is just for to support patients going through cancer. So we're selling these pink light bulbs. It's $5 donation. All the money stays back in our community. And like you said, counseling. So we offer a lot of support groups for our patients. We do a lot to help them get through this diagnosis. And chemo can really knock you for a loop. So you're out of work, you're not able to pay for babysitting, gas, the bills are coming in. So this money that we raise goes right back to our patients to help them get through treatments and really conquer cancer.
I like that. Where are we getting these lights?
They are at Hematology Oncology Associates, all 3 offices.
That's Brittonfield, my home base.
Yep,
right?
Brittonfield and East Syracuse, Onondaga Hill, and our Auburn office. Krause Hospital has them in their gift center, their gift shop there, and St. Joe's Imaging Northeast has that, and there's surgical physician's office there as well.
So you want us to get a light bulb, help out with cancer research and efforts and services, and turn this city pink.
Yeah.
Just put them on outside for the whole month?
Yes, the whole month. Turn it pink.
You got it. Thank you for joining me.
Thank you.
Again, that is Katie Tindall, breast health nurse navigator, and she's here at the studios at B104.7 because I don't want to be at her office. Thanks. It's Becky Palmer on B104.7.